Okay, here's our Ask Me Dr. Rajani question of the day.
Yes, I wanted to find out what the best treatment is to treat jowls or a face that seems to be falling around the mouth area. So, yeah, without a facelift.
Okay, there you go. It's what I do all day long. This is every single person that comes sits in the chair in front of me is going to ask this. And remember, this is what I do every day. It's what I teach. It's what I learn. It's what I study. So many people are getting information on from people on YouTube, on different platforms. They don't see patients. They don't do this every day. If you're doing this every day, you know this is a real struggle. And the lower face is the tough one. We can do a great job of the upper face. Whenever they talk about the lower face, it's a conversation. The reason is, yes, there's sag, and that's what the person sees, but it's oh so much more complex. It's also bone loss in the face. That's why I often talk about collagen supplements, vitamin K2, D3, whatever you can do to maintain the bone in the face. Bone, especially for the female, plays a big role in the lower face and the jaw. Just look at my videos on how much bone we lose in the jaw. So the more you maintain, the better. Healthy diet, healthy lifestyle, but no matter what, that said gets you. Now, she said without surgery. And what I'm gonna do today, surgery is a good option, by the way. If there's a lot of sag, a lot of jowling, people will need surgery to get the result that they want. However, 99% of people will say, I don't have 50 grand to spend on it, I don't have the downtime, nor do I wanna be cut. So watch my videos on the facelifts. However, non-surgical, the easiest way to answer this, my top 3. And understand, every clinic struggles with this and every surgeon struggles with it, even surgically, because there's only so much you can do because there is a facial nerve there which affects expression. You can't just go suck this stuff out and you could be still left with loose skin if you do. Number 1 treatment for the lower face is still addressing the upper face, the temples, the high cheeks, the preauricular area, and so many people don't use collagen stimulators and biostimulators here, but that pulls the face back. Then replacing what is lost with bone to the extent that you can with fillers, calcium fillers, Sculptra. You can use specific hyaluronic acid fillers, and that will not only hide the jowling, but it will also, if you do it in the right layers, mimic bone. Okay, so that straightens the jawline out. And then you can use some fillers through here, but fillers can widen the lower mouth. So you see people look funky because too much filler was used. That's why I use Easy Gel or platelet-rich fibrin gel all around the mouth and for vertical lip lines. So that's number 1 and the most common and the most accessible to most people. Number 2, I use radio frequency microneedling and external radio frequency heating. One uses suction and contours, and for me it's a Viora facial contouring FC applicator. We do a series, help shrink the fat cells. Alternatively, or with that, RF microneedling. So that's where the needles go in. On my device, only the tip is hot. And think of it as you're burning fat away. Okay, so 3 sessions of that, and I also do the submentum with it, and that's how I address that lower face. I'll give you a third that you have to be mindful, but you can also dissolve fat in this area. And by that, something like PCDC, so phosphatidylcholine deoxycholate in many countries, or in the United States and Canada, we have Kybella. Kybella in the US, Canada we call it Belkira. And they dissolve fat. Understand you can also dissolve the myelin around the facial nerve. And what that does, it's temporary. Usually it comes back within 6 weeks, but you get a droopy smile for a period of time. I've had a little bit done. I say 4 or 5% of people will get it because you're putting it right where that nerve is, whereas Kybella is really meant to be submentum where the nerve is not present. But in the studies and trials, it's always come back. But this is the area that it will happen. That's where the nerve comes, right above the jawline here. And it gives you, when you smile, you get a crooked smile. Everything has a side effect you see. Now, the best treatment is going to be all 3 of those together if you have significant jowling and you do not want surgery. Optimizing the upper face, fillers along the lower face, and then dissolving some fat and using RF technology. Most of my patients will do a little bit of all of those, not any of one thing. But that is what gives you the natural result. But that's why everyone's $5,000 to $10,000, because when you add those things up in the United States and Canada, and you do it in a sterile manner, safely, with state-of-the-art devices. Understand the devices cost the clinic $100,000 to $300,000. So those things need to be paid off. But if you're going to get it done properly and you're getting a series of treatments and you want to look natural and you don't want surgery, that's about the normal cost these days. When you start to go down in cost, people are, well, I'll just do the filler part. It's okay, but it might not be optimal. Well, I'll just do the dissolving part. Great, but you haven't replaced the bone or the fat. Okay, I'll do that, but not the RF microneedling. Great. Wouldn't you rather get rid of some of the fat? Then you need less filler, less easy gel, and less of everything else. So when you do little things, that's how you get the natural result. But yes, it costs more and money is a problem. Aesthetics is expensive. But safety is of utmost importance too. So it's just that balance. And you can, the nice thing about non-surgical, start with one. A lot of people say to me, hey Rajani, give me the number one thing. We're going to start there, and then I know you've recommended the two other, I'll then add it. So money is a thing, of course, and you have to budget for this, but for those who are older, I can tell you, it is a plastic surgeon lives across the street from me, and he's done thousands of facelifts. He's retired, and he said to me, I said, oh, my back was out. And he said, Rajani, you're old. I go, I know. He goes, it's when you get old, he goes, it's like a contact sport, okay? And it is. And the amount of maintenance you had to do at 20 was almost nothing. At 40, a little bit. By 60, I mean, it seems like your whole life is maintenance, maintaining your body, maintaining your healthy lifestyle living. And for those who still have to work, like myself, I love my work, but it's hard to eat right, be healthy, and do all those things because I'm always on the road. So yes, there is a lot of maintenance to getting old, but we're blessed to be able to be here to get old, to say, hey, I'm complaining about my back, I'm complaining about my face. Those are small complaints in life. So pick your top treatments, pick away at what's comfortable for you, and add them and work up to it. It's not surgery, you don't have to decide everything at one day. Minimally invasive gives you that opportunity. Have you treated your jowls? What's your number one treatment? That's how I do it. Every practice will be a little different. Stay tuned. Keep your skin and body beautiful, healthy, and vibrant.